And we are back with Dr. Sufi talking about babies and pregnancy. So let's talk about that first trimester because a lot is going on. Why is it important for moms to get that first screening?
We offer the first screening for all women because those are this is the time where you need to talk to your OB provider about learning about the test so they can screen for Down syndrome. That's one congenital anomaly that's very difficult to pick, sometimes up on ultrasound. So there are a variety of tests that we can offer our patients. The first trimester screen is usually done between 12 and 13 and a half weeks. And what we offer our patients is performing an ultrasound where they measure the neck thickness on the baby, and they do a blood test which checks for chemical markers on mom. And it's called a nucleotranslucency test. And we offer that to all our patients. And it's up to the patient whether they want to do that test. It's not mandatory, it's an optional test.
And is that just a blood test, taking blood from mom from, say, her arm?
Right,
okay.
Exactly.
And what about some of the tests that I've heard of that are a little more invasive? Are those up to the mom, or are those things that are medically necessary?
Right. So we recommend for our patients to talk to their OB about the different tests offered, especially to high-risk patients. These may include patients with history of miscarriages, women that are over 35, family history of any birth defects, and that type of thing. And one of the other tests that are new that just came out in the past year is called a NIPT test, which stands for non-invasive prenatal testing.
Okay.
What that is another blood test on mom, and such as a verified test. And what we do is we do a blood test after mom is at least 10 weeks pregnant. And what it does is it picks up the baby's chromosomes from mom's blood. It's such a remarkable new test that I think every woman needs to know about it.
And from your experience, and I know it's different for each insurance carrier, but does insurance usually cover the tests?
That's a very good question because it's such a new test. They need to check with their insurance carrier to see if it's covered.
And in terms of if a mother says, I just don't want that screening, are there any risks to not getting that?
No, it's definitely just a personal decision. So they can have that option if they would do anything different. They may not want that screening because it would not change what they would do with the pregnancy. Other women want to know as much information as possible so that they can be prepared.
Gotcha. And in terms of things that a mom-to-be should mark on her calendar, you have the first trimester screening if she so desires. Are there some other things that she needs to mark down, like the pertussis vaccine?
Right. And that's a new recommendation that the CDC has placed, is that they recommend that we vaccinate all our pregnant women between 29 weeks and 35 weeks gestation, because there's been an outbreak of pertussis and babies are unfortunately dying from this disease. It's the whooping cough. And so if women get vaccinated between 29 and 35 weeks, the thought is that the baby will get some immunity and it will help protect them before they can get their first vaccination.
And it should also protect the mom if she happens to be near that virus from passing it on to her baby as well.
Right.